Named fractures of the upper limb. So firstly, looking at the Colles fracture. Case of Colles fracture is nothing but an extra articulate fracture, and this is the distal radius, and along with the dorsal angulation, and this is of the distal bone fragment. So basically Colles fracture is something to do with the distal radius. Next, looking at the Gallese fracture. Case of Gallese fracture is a fracture of the lower third of the radius and the subluxation of the distal. This subluxation. This is of the distal radio-ulnar joint. Next, looking at the Monteggia fracture. In Monteggia fracture, there is a fracture of the shaft of the ulna. This is basically the shaft of ulna. So in the M you find a U, right? So that's how you remember. So it is the ulna, shaft of the ulna, and dislocation of proximal radio-ulnar joint. Next, looking at the Barton's fracture. Barton's fracture is nothing but an intra-articular fracture of the distal radius. Intra-articular fracture. This is of the distal radius. So this can be the dorsal as well as volar.